Hey guys, this is Amit and I come from Sydney, Australia. So I'm recording this video to give my good wishes to Dr. Karn Maheshwari. He is one of the best hand surgeons I think I have seen thus far. So just to give a bit of a breakdown on who I am and why I saw him. So basically I had a couple of tumor-like structures in my left wrist and I was not even able to wear a watch on my left hand because as soon as I would wear, the belt would suppress that tumor kind of structure and I would be in a lot of pain. So I went to Australian doctors. Australian doctors were not able to diagnose what exactly the problem is, and then I went to the surgeon here, orthopedic surgeon, and he suggested that surgery may be very risky because it is not just here, and I may lose my thumb if there is anything that is going really south. So I was scared, so I didn't go with surgery here. But then I was not able to live with the tumor either. So then I kept on researching what the tumor is based on the ultrasound report that I had, based on the x-rays I had. I went and talked to a lot of people, but there was nothing fruitful that I was able to find. So then I chose that, let me go and find a good surgeon in India. Like especially I come from Anand near Ahmedabad, Gujarat. So I thought maybe I'll just go and find a good surgeon in India, and from there I will go and get an online appointment and see what do they think. So while doing research, I came across hand specialist Dr. Karn Maheshwari, and in that period I did online consultation. He told me that I cannot comment anything because I haven't seen you physically, which made sense. It was a bit of a green flag for me. And then I had a scheduled trip to India, so I came to India. I thought I'll just go and casually see Dr. Karn Maheshwari. I did that. I went to Dr. Karn Maheshwari's hospital, and then from there, he recommended me to go and do a test. I did that test. The test waiting was too long, but Karn Maheshwari was really helpful, and he was able to arrange a quick test for me. So we did that. After the test, also what is exactly the diagnosis, we were not sure. It was more like there are two tumors, but what kind of tumor it is exactly, we were unsure. So the only way out was to operate and take the tumor out, and then we can send it for some analysis later, and from there we will find it out what it is. I was scared. I had been operated for a ganglion cyst when I was a kid, and I just said to him that I suspect that you may operate, take it out, but it may come back again. And he was like, no, I'm pretty sure if I will operate, I will make sure that I'm taking the root cause out as well. I will not leave anything that may reproduce into another tumor. I was like, okay, sure. But I was still inside, I was scared, I was nervous. But I took a bit of a leap of faith, did the operation. Operation was successful, and after analysis, it turns out that there was one ganglion cyst and there was another one called schwannoma. Schwannoma it's a bit of a rare tumor that doesn't happen to a lot of people. It happens to maybe 1 in 1,000 based on my reading, or probably 1 in every 10,000 people. Anyway, so we did that. Dr. Karn Maheshwari's operation was so successful. I had done a lot of reading on ganglion cyst, and it was mentioned that 70% of the cases the ganglion cyst comes back. But it's almost 2 years now. The operation was done on March, I can't remember the date, but it was late March 2024, and now it is 4th of December 2025, and nothing has come back. The only thing that is there is a bit of a scar mark, which I'm happy to live with. But apart from that, I guess Dr. Karn Maheshwari is super competent surgeon, and I would recommend everyone to go and see him for their orthopedic needs. Thank you.